Hello there, and welcome to the latest edition of Compression Chronicles. Today I'm delighted to be joined by Dr. Wade Farrow. Dr. Farrow is a physician engineer with more than 24 years clinical experience, including more than a decade as a medical director of a busy wound care, lymphedema and hyperbaric clinic. Dr. Farrow is also a wound care innovator. Alongside 14 issued patents and unique full cycle medtech success with medical device development, Dr. Farrow is the inventor of the FarrowWrap short stretch compression wrap, an alternative to patients who have trouble wearing traditional compression and bandaging. Dr. Farrow is an internationally recognised lecturer on compression, lymphedema and wound care, and former teaching physician at Texas A&M University for nurses and medical students. Thank you, Dr. Farrow. First question, what patients inspired you to create FarrowWrap?
Well, it was probably a series of things. We had for several years. When I first started doing wound care, I kind of came out of surgery. I actually was in head and neck surgery residency. It's a 6-year program, and after 2 years, I was just like kind of burnt out, honestly. I did electrical engineering undergrad for 5 years, 4 years of medical school, trying to get into a top surgery residency, and it's a lot of work, a lot of stress and focus, and so I ended up leaving, and I went back into engineering. I always wanted to do biomedical engineering. I felt like that's kind of what God wanted me to use my skills for, and then kind of fell into wound care, and had opportunity to start a wound care clinic. And I felt like, oh, this is one of the few things I'm really kind of qualified to do with 2 years of surgery residency. There's not a residency program in wound care. There's some fellowships now, but at the time there's nothing. There was a hyperbaric fellowship, but anyway, kind of fell into it. And so we were taking care of patients, and I was fortunate to have Dr. Carolyn Fife as a mentor, and owe much of my career to her. And she's an excellent educator and clinician and very passionate. I lived at her house and kind of did like a little mini fellowship for a month and then got started. She was a medical director for the first year. And so I was learning about the care of lymphedema. Like, oh, wow, like no one taught me about lymphedema in medical school, and about short stretch bandaging, which is kind of the gold standard to use between your treatments for lymphedema, what we call complete decongestive therapy, which is manual lymphatic drainage, MLD, plus bandaging, and some other things, skin care and exercises and things like that. But basically the tenets are the special manual lymphatic drainage that the therapists do, and the bandaging. And so we wanted to use some of these bandages really for wound care patients. And so I remember bringing in home healthcare nurses after clinic and teach them how to use a short stretch bandaging. Like, oh, they're 100% cotton, they're reusable, and so can teach you to do this. And so they would do okay, but then they would forget how to do it. If they went a couple months and didn't have a patient, I remember wanting to come back and be retrained. And like, wow, this is interesting. But then, when you think about the lymphedema patients, the therapists are working with the patients, multiple times a week, sometimes up to 5 times a week, usually at least 2 or 3 times a week during their acute phase reduction. And so they really, get plenty of time for this training to train family members to put on the bandages and help change them. But in wound care, it's, kind of not like that. And so they would come in and the bandages would be falling off sometimes or be loose, or the fact just that they needed retraining. It's not that easy. And yet there really hadn't been anything that stayed on better in the lymphedema short stretch market. There's only really one type of bandage. There are different sizes and widths, but they were all really this kind of woven cotton material. And so I had a patient who couldn't wear compression stockings, and we have a lot of patients like that. But this one in particular, was on Medicaid and money was tight, and had to go spend money to buy a non-elastic Velcro garment. And so at the time, the patient got those. I'm like, oh, this is great. I'm really happy. And so we always do something called a garment check. We want to have the patient make sure that they can wear the garment that's working for them and it controls their edema before we discharge them from the clinic, because we don't want them to have to come back in for complications or re-swelling. So the patient came back in for a couple weeks later and like, oh, it gets loose, it falls down, and I hate this. So the patient made one actually out of suede leather, but it's completely inelastic. She's like, I like this one better because it doesn't fall down. So I'm sitting there looking at it. It's like, well, yeah, it doesn't fall down because it's suede, it's thick. It's probably like something the Roman soldiers used to use. They used to use leg bindings too. And but then it's, it's inelastic. Well, if it's inelastic, there are several problems with it, inherently compared to short stretch bandaging. It doesn't conform to the limb is one. Also, it's very common for patients to get reduction in the swelling. For example, we would put multi-layer compression wraps on a patient, and I remember, putting them on, and the patient going out to their car, and they stepped in a water puddle. So they came back in, and we immediately, took it off because it was wet, and they asked us to. And so, you're getting ready to go to lunch, and they're like, oh, we got to, redo the wrap for the patient, but that's what we did. And then, they immediately were reduced 1.5, 2 centimeters. They had wrinkles in just 15 minutes. So, you really need a certain amount of stretch to accommodate that, because if you don't stretch at all and you're immediately reducing a centimeter in 15 minutes, you're going to be dropping, 1 or 2 compression classes. So these things were kind of working in the background really from several years, of working in the clinic, in the engineering degree.
So you were
And so,
perfectly placed with your clinical
yeah,
experience and your engineering
and
background
I also was
to solve the
fortunate.
problem.
Yeah, I also was fortunate. I had been an exchange student in Switzerland, the German-speaking part of Switzerland, and I'd lived in Germany one summer. I actually decided to go to medical school. So over there working as an engineer. So I kind of understand, there's something, a word that always sticks to my mind. It's called regelmäßig. It's a German word. It has to be exactly so. And Germans are wonderful engineers, but it's like, well, immediately it's like, well, this needs to be short stretch. And then I was like, well, yeah, but it's hard to do because there's only one short stretch bandage. If you want different compression levels, you have to use multiple layers of bandaging, or you for instance, go from being spiral to a figure 8, which gives you additional layers. And so it's a complicated problem. And it's like, well, we need to change this and have more elasticity to it. And this is all going on in milliseconds, right? It's kind of like, they call it lightning in a bottle. I remember when ZZ Top wrote LaGrange, it just came to him, boom, there it was in 2 minutes, one of their top songs ever. And, it's kind of like, you just get the epiphany idea, but in the background, there were all these things, living in Germany, kind of understanding that, the Germans would never do this because they'd always be worried about a tourniquet effect, and the measurements, it must be precise. But I knew immediately, it's like, I can innovate and, another short stretch technology and call it elastic short stretch. So, and we can make it so that the garment stretches about 30%, but we can make it safely so that it won't be a tourniquet and it won't have that risk. And that you only need 1 or 2 layers, in order to do it. So it'll be easier to put on and put off. Because it stretches, it will conform to the limb better. Because it stretches around 30%, and by the way, these short stretch bandages, they say stretch, 60, or some even, the data even says up to 90%. It's what we call pre-stretch, the first time you stretch it. But when I stretch them, it was really around 30% once they had been put on, initially, and kind of gotten the pre-stretch out of the fabric. And so that really was good because we want to apply it at end stretch. Now, the other thing we didn't talk about was Una boots. So Dr. Gerson Una invented the Una boot. I think it was 1898. And, it's been a fantastic product and helped, probably millions of people over the years. It's a zinc paste boot, but it's also completely inelastic. It's been kind of a mainstay, more for venous disease, probably, than lymphedema. It's a zinc paste boot. You would put it on and change it, multiple times a week to treat their venous ulcer. Well, it also is non-elastic. And so when I first opened the clinic, we call up the doctors and hey, we have a wound care clinic, never had one before. And Brian College Station, you got any patients? And one surgeon was like, oh yeah, I got a patient, and sends them over. Well, it turns out they'd put a Una boot on the patient, and the patient had complete neuropathy and had a very large, wound on the tendon because it didn't conform and they didn't have any feeling there, And so we were able to get the patient healed up. As a complicated patient with lots of medical problems, But that was always a lesson for me. That's well, the Una boot is really kind of outdated and it really needs to be short stretch. So I kind of had that also in my background, of my mind, going for almost a year, So all these things really kind of contributed to this kind of eureka moment. And so then I go running off and trying to find fabrics and things. And gosh, I wish we could draw a graph here. Maybe we'll add one. But when you look at any kind of elastic, let's take the simplest thing, you take a rubber band, when you pull the rubber band at first, there's almost no force. And you pull it and stretch it. And then the more you pull it, the more force you get. So it's an exponential type curve. And so, the reason something can become a tourniquet is because you're operating on the upper part of the curve, where a short distance makes a very large change in the amount of force. So, inherently, I come from like, third generation engineer, was like, well, if I make this elastic short stretch, I need to operate on the flat part of the curve. So when it kind of goes here and then goes up. So we took an outer material that had a lot of elastic bands in it, but we don't want to pull it real tight, because then you could end up with a tourniquet effect. So then I started looking for another material, and that second material's purpose was to limit the stretch and kind of provide kind of a little bit of lockout, what we call the bandage lockout. And I found the material, online out of Washington State, and I think it's like a 4-way stretch material, actually shoulder material, and made in Switzerland of all places. And so I ordered the sample material and put them together, and it was like perfect, And I found an engineer at Texas A&M who had what we call an Instron material. We could check distance and force, and we really had duplicated almost perfectly short stretch bandaging. And then also kind of how you cut the fabric made a difference too, because it affects the stretch a little bit. So you can do it at 0 degrees, 90 degrees, at 45 degrees. And so together, we ended up with really what is still today the classic. And, this is, gosh, it's like I'm getting old here, because I invented this, I think, in like 2002. And we're about 24 years later, and it still is one of the best product lines in the FarrowWrap line. So it turned out to be really about perfect clinically.
Yeah, thank you for sharing that story. So we talked about the two fields of engineering and medicine coming together. What I also appreciated was the arts also being compared with the way you had the inspiration was like a songwriter getting the words and the melody for a song.
Yeah, I think for me, I've always been very creative, but it's kind of been an engineering sense. I was always playing with Legos, and I was supposed to go to bed, and I remember getting out of bed and being playing them with my Legos, and I'd hear my parents coming downstairs to tuck me in. I'd go and lay in like I was in bed. I'd get back up and work on my Legos, and I was trying to build a robot, very unsuccessfully, but in high school, but I was always building and tinkering with things, and just kind of was, I guess thinking like that. But yeah, I always draw from creativity. I mean, I love inspiration in music, different types of art. I like visual art, I like sculptures, I really like sculpting. Really, any time where man has done something creatively, even architecture, and I think we should always, try to draw inspiration from other things that people have achieved, mankind has achieved, and hopefully, if we can find an outlet to do that and help our fellow man, then I think, we're probably fulfilling one of our purposes here on Earth, So trying to do that in my own way.
So why was JOBST the perfect partner in developing the product and really bringing it to market?
So the JOBST brand is very famous. In the United States, this was really the first company, and the inventor behind it, Conrad JOBST, actually had swelling and found relief in the pool. And so when you're standing in a pool, there's actually more force at your ankles than there's higher. And so he realized we needed gradient compression. We needed to have the compression stockings the tightest, like around the ankles in the case of leg garments, and then gradually reduce that as you get closer, it's really to the top of the garment. So because it really is all basically pressure from fluid, and you kind of measure it really literally from your heart, if you were standing there. So it kind of gets a little more complicated with the physiology, but that's kind of the general idea. So they had built this brand up into the premier brand, and so I've always had a lot of respect for the JOBST brand. And we frankly also, just as a company, we ran the company for over 10 years, which was very hard, and like for many years pumping half my salary into it. My wife thought I was crazy, my family thought I was crazy, but I never doubted. As soon as I got the idea, I knew that this was a great idea, and I knew it would work and help people. And then, even early in the commercialization phase, we first started like, oh, I can just make 10 garments a day, then I can break even, and sell 10 a week, or something, and then a few years later, oh my gosh, we can just sell 100 a day, then we can break even. We're still losing money, but we were growing. But yeah, at the end when we sold it, we had over 35 employees, and we're doing millions of dollars worth, and we're still barely making any money, but we're just starting to get where it could really scale. But it kind of came time where you had two full-time sales reps. It's very expensive to have a sales rep and to pay them to be out in the field, and we only had one product line. So on one hand, we could focus on that and really teach and educate people about elastic short stretch and the FarrowWrap. But on the other hand, at some point, you need a full line of product in order to scale your sales force. And JOBST, had that, and they had, the name recognition and the brand. And so I think, it was a blessing to my family to find a great place for it. And so I've been very pleased.
Perfect partnership. What problems did you see with traditional compression options?
Well, first of all, anyone who can wear compression stockings, I feel like they should, because they're thinner, and the problem with compression stockings is really they're hard to get on, right? They're hard to don and they're hard to doff, both. They're made to be tightest around your ankle, and getting that over the back of the heel, is the difficult part, because it's up to 1.5 times the circumference of what you call your least ankle circumference. So, that's the biggest problem with compression stockings. And then if you get ones that have less compression, they're easier to get on, but they may not be, therapeutic. So, if you can get on the 15 to 20s, but you need 30 to 40 millimeters compression, then you're still going to swell under them. The beauty about short stretch is that when you apply it where it's near in stretch. So in the case of someone who has swelling, it's going to shrink down and conform them. It's going to conform to the limb. They'll have, the swelling being reduced, and it'll still be, some therapeutic because it has some stretch left in it. Take the opposite. Let's just take someone who has no swelling in the morning. The little old lady who sits in a wheelchair at the nursing home, right? So during the course of the day, she's not moving around much. She has some chronic venous disease. Then she starts, to swell during the day. Well, the short stretch is perfect because it contains her. It's applied near end stretch. So the more her leg tries to swell during the day, the more the wrap counteracts it. So really, the short stretch technology, we always say classically, has a lower resting pressure and a higher working pressure. So we say it's really a safer compression technology, and I really believe that, and it's true. In fact, some studies have actually shown that you take people with arterial blockage, and they actually increase their blood flow while they're wearing short stretch bandages, which is pretty amazing. So you actually could take someone with moderate, fairly advanced arterial disease, put on short stretch, like a FarrowWrap or short stretch bandaging, and have them do exercises with it, and actually probably improve their blood flow, over time, which is really kind of fascinating and counterintuitive. So, pretty famous study done by Harvey Meyrovich.
Fascinating stuff, 100%. How did your engineering background influence the design of FarrowWrap?
I think, just things like understanding spring constants, understanding like for the rubber band that it's an exponential type curve, understanding that we want the bandage lockout, always kind of think like an engineer first, and then a doctor second. It was hard for me, honestly, in medical school. I felt like I was always into medicine because I wanted to innovate, but sometimes you need to be in the trenches to see the people that need it. I was very interested in kind of neuroscience and things. Neurosurgery, really tough, residency program. Very many years. I think it's like 6 or 7 years. And then neurology, sometimes it's really cool to diagnose, but it's hard to treat. So I ended up in ENT. Maybe I should have done one of the other two. I still wonder about what I should have done. Or dermatology would have been a really good one because it would have been less stressful and more time. But there are some, really excellent, wound care physicians who happen to be dermatologists. But I guess, I had a different pathway. I kind of think about the J.R. Tolkien quote, not all who wander are lost. So whether I did it on purpose or not, here I am. So I'm kind of an anomaly in the healthcare system, but doing the best I can.
Well, it's worked, hasn't it? Because you've brought this amazing product to market. What major breakthroughs helped shape the classic fabric?
Well, I think some things I probably didn't even appreciate at first was the rigidity of the fabric. You really have a unique ability to contour and shape it as it moves around the limb. That was something I probably didn't appreciate for several years. I kept wanting to make a thinner garment and more breathable and things like that, but we really had about perfect performance with the classic. We always knew that we had the right compression level. It was always the little things like that I wanted to change. But I think that really is why the classic was the first and still one of the best products.
And then can we talk about how FarrowWrap is different from stockings or multi-layer bandaging?
Well, the multi-layer bandaging, usually requires different layers to get different amounts of compression. We kind of engineered these where we get 2 layers of compression. Now, that's one thing I guess to also emphasize. We talk about these is because there are some products that don't have but 1 layer bands because they kind of alternate. But we really, the other thing I didn't appreciate probably for a few years was that the different layers of short stretch bandaging, or even if you take like a multi-layer bandage, which all of those products are medium stretch, but when you apply them, the different layers, there's actually a friction between the bandage layers. And so they increase the overall rigidity of the garment. So by having multiple layers, I think we better duplicate, the gold standard, which would be the short stretch bandaging, yet we're easier to get on. We have that patented range of elasticity around 30%. I consistently get people saying, well, you still have the best performance of any product on the market, and it's because of this range of stretch that we have. And yet we were able to make this safe. We used to do custom garments, and I remember even making them for like 2-year-olds or something, because they're in a really tough spot. If you have a lot of lymphedema, the more you leave the lymph fluid in the skin, it has a tendency to become chronic and kind of lay down permanent, kind of fatty tissue. So, even in a kid with that, we want to reduce the swelling, the lymphedema, and keep it out. And yet they also are not a good candidate for custom garments because they're growing so quickly. So, but, at least we have some, variability. So we actually, had a different type of compression, the light fabric, which was the next product we developed, because I wanted one that was short stretch, but maybe even a little bit safer, a little bit thinner, and had a lower resting compression around the 20 to 30 range. And so we made custom garments for even 2-year-olds and put these on. We put them on people, up to 100. I remember going over to someone's house, early in the process, and, when the patient had diabetes, they had arterial disease, they had neuropathy, and they had bad leg swelling. They weren't a good candidate for compression stockings, and the wife, they wanted, something to help them. And I remember putting the wrap on them and be like, oh boy, I hope this works, and they actually, did really well and didn't have any complications. So it was a blessing.
Can you explain the differences between classic, basic, strong, and light fabrics, and when each
Yeah.
should be used?
So we talked about the classic kind of being the true, so that's kind of your gold standard. The next product that we developed was the light. So the light is a little bit thinner, and it has around 20 to 30 millimeters resting compression. So it would be more appropriate for people with a smaller limb diameter, people that maybe had arterial disease or very fragile skin. We have people who, as you get older, your dermal layer gets thinner. Also people that have been on chronic steroids for decades, and so these people or have dermatological conditions. We had someone with epidermolysis bullosa where they get these blisters and things on a constant basis, and yet they have swelling and wounds. They're really not a good candidate for stockings. They're going to be either bandaging for the rest of their life. But it turns out the FarrowWrap Light was a great product for them. So that was kind of the second product line. So then I wanted to make, another, product line, and that ended up becoming our strong fabric. And the strong fabric is one of our most underutilized fabrics, I think. It's close to the compression level of classic. It has the same range of compression, but not quite the rigidity and ability to contour. But it is also very comfortable and softer, so it's preferred by many patients. So, if you have the really bad lymphedema, I recommend the classic. The people underneath that with kind of the moderate swelling or edema, lymphedema, a lot of them will do well with the strong. And the basic was frankly a low cost option. We wanted to get a Medicare garment. We were making all our garments in the United States, and a lot of our fabrics came from the United States, and we needed a lower cost product that could fit one of the Medicare reimbursement codes. And try to get those patients taken care of. And so that's how we kind of came up with the basic.
Which patients benefit most from FarrowWrap, would you say?
Well, I'd say lots of patients. Really for anyone who can't put on compression stockings, I always say the FarrowWrap should be the next choice. That they should do. It's much better than bandaging. And so we have people whose edema fluctuates, during the day. Sometimes they can wear compression stockings, sometimes they can't. You actually could have both. You could have compression stockings, but then if you re-swell and can't get your stockings on, your choices are to go back and get your leg wrapped in a multi-layer wrap or short stretch bandaging again. But if you have the FarrowWrap at home, you could maybe put that on. So, so that's one thing, people whose swelling fluctuates. And we have a lot of those patients, people with heart failure, people with renal disease, the medications, for cardiology medications for your heart also often cause vasodilation, and so you end up with more leg edema. And people with sleep apnea. We have people with bad backs who sometimes sleep in reclining chairs, and so their leg swelling tends to get worse. So anyone who can't wear compression stockings, as long as you can reach the top of your foot on top of a stool and tie your shoe, we say that you're a good candidate for the FarrowWrap.
And what are you most proud about regarding the impact of FarrowWrap?
I just think, hearing from therapists and patients who it's helped, over the years, and it's really been, a blessing, and it was a lot of work and a lot of stress, to try to start a company. I didn't really know anything about starting a business. I really come from an engineering background, and then, medicine, always technical. Both my parents had always worked for someone else. Did kind of have an entrepreneurial spirit even from, as a kid, I guess. And doing things like that. But, I had to learn, running a business. I had to learn marketing. I had to learn branding. I say we did everything backwards. We manufactured garments in the States where it's more expensive. We didn't have a marketing person for 5 years. Honestly, we succeeded because we had a great product. But then part of this too is learning to adjust, over time and change and learn, and so I was fortunate enough to be able to do that and had great people, around me and a great team and support. And my partner, Dr. Barry Creighton, has been instrumental and is still, we're very close.
So how was working with JOBST and Essity helped to expand access to FarrowWrap?
Well, certainly they've expanded the market, because they have so many sales reps and have so many customers and durable medical equipment bases, so they're able to get the FarrowWrap into places that, frankly, when you have 2 sales reps, you're only limited, with what you can do. And so, that's really been the biggest blessing. And of course, they're in many countries as well. So I think FarrowWrap is in a few other countries too. So that's been very helpful.
So we've talked about the story of your innovation and your inspiration, and how you've brought a product to market that's helped people and improved lives. But why is it so important that innovation needs to continue in this field?
Right. Well, I mean, I think to the people's benefit. When I first started engineering, I actually started off in biomedical engineering, but then, someone was like, well, biomedical is all encompassing. It's mechanical, it's electrical, it's material science. Maybe you're better to get your core, background in a different type of engineering than switch. And then I used to get the little Radio Shack, electrical kits and play with them, but I didn't, really fully understand, some of the things. I learned some things. I knew more than, your average person, but certainly didn't know as much as like an engineer. So I wanted to take the electrical engineering class. Well, it was a huge weed out class. It was very difficult. Only like half the people, stay in it, and then like I think only half, pass with a C or better. So you're basically getting 1 out of 4 people, getting through that class with a C or better grade. So it's really tough. So they won't let you take it unless you're majoring in electrical engineering. So I was like, well, I'll just change to electrical engineering, and I'll just change right back after I take the class. They're not going to stop me. It's kind of, I guess, the entrepreneurial mindset. Like I'm just going to, find a way. But then I ended up, like, well, I could go get my master's in electrical engineering. And so that's how I kind of majored in electrical engineering instead of biomedical. But I'd always kind of had this mindset of, well, I'm good at engineering. My dad and my granddad are engineers. I'm good at this kind of thing. But, if I did medical products that help people, then I can always feel good that I did the best I could with today's technology to help people and to try to make a positive difference in the world. And so that's really how I decided in college I wanted to focus on medical devices, and kind of felt like that's what God wanted me to do with my life. And that's really how it all kind of started and evolved into where we are today. Which I have another company, that I've started called Exonics, kind of outside the scope of this call. But, working on my second one, which is a product to debride and scrub wounds. And we have a lot of innovative technology for that.
So outside of medical innovation, and we always ask all of our guests, what do you do at the weekend? What do you do to relax? What do you do outside of the work?
Well, I'm a big tennis player, so play tennis quite a bit. I'm fortunate to have a club. We have like 27 clay courts and indoor courts and hard courts, pickleball courts. Was playing pickleball, then I got an ankle injury, and so like for right now, I'm just gonna stick to clay court tennis. Try to stay on the court, but that's one of the main things I do. I also love guitars, more collecting them than playing, I guess. But I tried to play, and if I had more time, if I didn't have a second company, I would probably play more. But that's something I'd love to do. And I play piano. I took piano lessons, but I was probably more talented at the science and things like that. But I can do it. I have good eye-hand coordination. I don't have like the natural ear to always know what note you're on and things like that. But uh, but yeah, I love doing that. I love hiking. I love being outdoors, and I would love to do that more. I love Western Carolina mountains and conservation and even kind of getting into bonsai and things. So I have a wide range of interests and busy at church, the church that we go to as well. Do some volunteering there.
Thank you so much for joining us. It's been a pleasure to have you. Thank you, Dr. Farrow.
No, thank you very much. Appreciate your time. Thank you, everyone.